Our final speaker will be Dr. Divya Venkat. She is the Inclusion Health Track Director at Rethinking Incarceration and Empowering Recovery Clinic in the Allegheny Health Network. At the Post-Incarceration Clinic, Dr. Venkat works on transitioning patients out of incarceration while focusing on their health and social determinants of health. She's also the medical director of the Prevention Point Pittsburgh Mobile Medical Unit, and her work focuses on the integration of harm reduction and low barrier access into healthcare settings. And we are so happy to have her with us today. Dr. Venkat?
All right, I think I have control of the screen. It's so nice to talk to you all today. I'll be building on what my previous presenters spoke about, which is really the idea of creating a model that helps people re-enter into society after incarceration. So I'll be talking about our model called the Rethinking Incarceration and Empowering Recovery Clinic, or the RIVER Clinic for short. So my objectives today are, number one, to describe a post-incarceration care model, 2, to outline the CIH River Clinic, and 3, to demonstrate the impact of our model. So just like everyone has kind of talked about already, why is the post-incarceration care model important? When we build these types of models, it's important to acknowledge 3 things. One is that there is a gap that exists between carceral settings and civilian life. 2 is that we need to create an infrastructure that ensures the continuity of care between complex settings, carceral settings, and outside of these carceral settings. And lastly, to provide support to address the social determinants of incarceration. Like the previous presenters have mentioned, incarceration is so much more than healthcare. It often involves things like access to education, access to a job, housing, healthcare, insurance, and really just going back to a previous environment where someone may have been incarcerated. So what is a post-incarceration care model? In many of these models, patients are referred directly from carceral settings to a post-incarceration clinic. Typically, prior medical records are shared between the carceral setting and the clinic in a HIPAA-compliant method. Post-incarceration care then focuses on acute and chronic medical problems, connectivity within societies, and collaboration with local organizations to improve health and wellness outcomes. This is just a typical flow that might happen within a post-incarceration care model. So someone is released from incarceration, and through a direct referral to the clinic, contact with the clinic is made. Many of these clinics have access to behavioral health clinicians, a social worker, a healthcare provider, community health workers, and nurse navigators. I want to highlight one post-incarceration care model that has really done an excellent job demonstrating their success and the importance of this model. This is called the Transitions Clinic. They were started, I believe, out of UCSF and are at Yale and many other places. But what I really like about this diagram is kind of what all of our missions are. Is number one is we need to build capacity for team-based patient-centered care. In all of these models, the most important thing is that we're putting our patient or our client right at the center of our services. It's crucial to hire and integrate community health workers into these models. People who have had a history of incarceration or who even understand the neighborhoods from which our patients are coming from. We need to leverage systems and services that exist within the healthcare system that we exist in. Community partners are critical to making sure that our patients can navigate through healthcare and just life after incarceration. In their model of success, what they've seen is multiple things. Some of the important things that I think really count towards our clinic are highlighted here. One is that in the Transitions Clinic out of San Francisco, people were less likely to visit the emergency department and had 50% fewer emergency department visits. This is a really, really awesome bargaining chip within a healthcare system because it decreases ER utilization and healthcare spending. $912 were spent less per year in healthcare cost utilization. More than half of the participants had at least 2 primary care visits after release and engagement within the program. Additionally, this model reduced illicit drug use and overdose risk, criminal behavior, recidivism, and most importantly, mortality. Again, these models exist not just to help improve someone's life after incarceration, but to help our clients live, which has been really highlighted during the COVID-19 pandemic. So now I'll talk a little bit about what the CIH River Clinic is all about. So these are our keys to success. So the CIH River Clinic is a part of Allegheny Health Network in Pittsburgh, Pennsylvania. We're also part of a greater organization called the Center for Inclusion Health, which really focuses on traditionally excluded populations. So these are three feeder systems and part of the ecosystem that we exist in. So the Center for Inclusion Health is extremely embedded within the community organizations of Pittsburgh. Because of that, it helped us a lot get in touch with other organizations and really find support within our community. Additionally, our health network has a contract with the Allegheny County Jail. We provide some of the healthcare providers within the jail. When we wanted to make this clinic, it was extremely important that we got the Allegheny County Jail on board with us. This often meant multiple phone calls per week, emails, trying to figure out exactly how we could get a referral system in process and support the Allegheny County Jail, especially during the COVID-19 pandemic. Again, like I highlighted, one of the more important parts of our clinic is our community-based model. We really believe in outreach within the community and engaging the people around us to ensure the success of our clients. We also really care about a warm handoff. So like I mentioned, the healthcare providers within the jail also are a part of Allegheny Health Network. We've worked with Allegheny County Jail to ensure a HIPAA-compliant process in order to get patient referrals. When patients are in the jail and when they come out of the jail, we ensure that patients have given us like a written consent so we can talk about their healthcare amongst multiple providers. So what are our clinic goals and why did we create this? What we really cared about is that all these patients would come out of the jail and had no access to healthcare. There was nowhere for people to go to get almost like a warm security blanket around them or a safety net when they were trying to reintegrate into society. So one of our first goals was to increase access to health insurance and social services. We care about providing comprehensive care to recently incarcerated individuals who face multiple social determinants of health issues. We also treat a variety of healthcare conditions, including diabetes, substance use disorders, hepatitis C, and behavioral health. Our goal is to alleviate the social determinants of health by engaging with an in-clinic social worker and a community health worker. And our long-term goal is to transition patients to long-term primary care providers after engagement within our clinic. This is a really busy slide, but it's just to show you the flow of how our clinic model works. So the discharge and release team at the jail will actually notify us when a patient is about to be released or has already been released. Our social worker and community health workers will then contact the patient within 24 hours of release. This is really critical. As many of the previous presentations highlighted the data around post-incarceration care, within those first 2 weeks is really when our patients are at highest risk for overdose. Being in Pittsburgh, Pennsylvania, opioids have really hit our community. And so it's really important that we engage with patients right away and provide low barrier care. Once our social worker or community health worker has been able to connect with a patient, they get an immediate connection to a healthcare provider. And during that time, we often prescribe medication for opioid use disorder. Prior to coming to the appointment, there are multiple touch points by the team members. Our team is on it. They're constantly calling patients, texting them, trying to figure out exactly what they need in order to be successful in their lives. The patient then arrives to our appointment. During this time, a healthcare provider will complete their initial appointment assessment for things like chronic conditions and medication needs. But frankly, I think most of our patients come because of the rest of our team. The social worker and community health workers really work towards helping patients reintegrate. They'll do things like social determinants of health screening needs. They'll ensure that people have transportation. We work pretty intensely with our criminal justice system to advocate for patients to stay out of incarceration. So this is our clinic structure. We have 2 physicians, a nurse practitioner, and a pharmacist. And together we address things like medications for opioid use disorder, hepatitis C, and really just a low barrier model of care. Our nurse navigator focuses on medical management within the clinic. Our community health worker visits people actually within ACJ so that she can start establishing a rapport with patients immediately. Oftentimes, exiting incarceration can be quite complicated and really just difficult. And so by having someone who's already seen someone within the Allegheny County Jail, a person is often more likely to reach out to us because they know that warm face. She also works very closely with community-based organizations. to ensure the optimal community engagement on release. Our social worker works very closely with drug and alcohol programs to ensure that patient outcomes have been improved with substance use disorders. She also works collaboratively with housing teams to improve access to safety and often provides things like brief intervention for our patients. Our patient care navigator ensures quick access to health insurance and benefits on release. Most of our patients, their Medicaid product has been turned off or has been, as they say, I guess like put on hold on release, but our patients don't have a way of actually signing up for healthcare again. So we ensure that that is turned on quickly, and she works very closely with our health insurances around here to do that. She also establishes continuity of care plans for our patients after they've completed time with us at the River Clinic. We also have a psychiatrist that's been funded by a grant, and she focuses on the effective access to care by regular screenings with things like the PHQ-9 and PTSD screenings. What I really wanted to highlight, though, is that we're much more than a clinic. Our whole clinic model is really based on this concept of outreach. Most of the week, our team is actually not even in a clinical setting. One day per week, 2 half days actually, the team is parked literally outside of the jail, and we're just welcoming people who have been released from jail. We do a number of things. We help people get bus tickets at that point. We see if people have medication needs. We help people get into shelters that are available throughout the city. We also park in different parts of the city to see if we can find people who just need help. Most recently, we parked at a soup kitchen where a lot of our patients and clients actually go to, and we just reach out to try to find them. One of our biggest barriers is actually most of our clients don't have cell phones, and so that requires a lot of innovative thinking, and we've done that by really going into the community and immersing ourselves in what our patients may be experiencing. When we hired the people in our clinic, we ensured that we hired people who are from the neighborhoods that we were serving, and that has really served us because the people that are working with us know our patients the best and actually can guide how we're designing the clinic every step of the way. We also go within Allegheny County Jail. We have our community health worker and our social worker physically go inside the jail, meet patients regularly. Being that it is a jail, a lot of our patients do end up being reincarcerated. And so having our community health worker and our social worker go back in helps patients realize that we're always there for them. So the outcomes that we always have looked at are things like reducing hospitalizations, treating and eradicating hepatitis C, reducing opioid overdoses, and increasing retention in medications for opioid use disorder. Ultimately, we'd like to reduce recidivism and also show reduction in the social determinants of health needs. We started our clinic in June of 2021, and we've had over 400 referrals from Allegheny County Jail. We've actually engaged with 60% or more of those referrals, either by a phone call or finding them within the community. In this moment, we have 50 active patients. Over 100 people have completed care with us and transitioned into their community. This means that we've made a warm handoff to a primary care physician, a treatment provider of any sort, or even just other case management services. We've actually reduced rates of return to use and reduced rates of recidivism by engaging patients in rehabilitative programs. We advocate within a lot of the court systems to have patients, instead of going back to jail, to actually go into treatment. And we work with patients while they're in treatment to make sure that they stay engaged. 12 patients have completed treatment for hepatitis C and achieved FCR. Some of these patients have been actively using and sometimes don't even come to clinic, but we figure out a way to get them their medications. And of the patients that we've engaged with, only one has overdosed within 2 weeks of being released from jail. This is a drastic decrease from the numbers that we know exist. That's all that I have about our clinic. I'm looking forward to answering any of your questions. But if you have any questions outside of that, this is my email address. Feel free to email me.
Great. Thank you so much, Dr. Venkat, for sharing the work of the River Clinic and your care model.